Alrighty. Good morning, everyone. Thank you for joining us. We're so excited to have you here. We're really excited to share with you guys the Wellness League, what we're calling an ecosystem of patient support. So let's go ahead and get started. So just a couple of housekeeping items before we get started. First of all, this webinar is going to be recorded, and we plan to send you a copy of the recording after the event later today. And then finally, we invite you to use the Q&A tab at the bottom of the screen to enter your questions. We're planning for some time at the end to answer them, so we'll get to them towards the end of this presentation. So if you're wondering who's speaking to you today, this is me. My name is Tiffany Mensah, and I'm a program coordinator at the Fatty Liver Foundation, and I work primarily on the Wellness League. So the objective of this call today is to introduce you to the Wellness League. The Wellness League is a project of the Fatty Liver Foundation. It's one of our flagship projects. It's a platform that's online, and we've designed it to deliver a variety of non-clinical interventions to address the needs of our patient community. And we do this through 4 main areas, and those are health education, liver health screening, linkage to clinical trials and care, and wellness navigation. So here's an overview of what we're going to be talking about today. So first, we're going to start with some introductions, then we'll move into the patient perspective, followed by the provider perspective. I'll do a live demo of the Wellness League. We'll close it out with some closing remarks and then end with some live Q&A. And with that, I'm going to pass it over to Wayne to give you an introduction to the Wellness League and the Fatty Liver Foundation.
Well, thank you, Tiffany. Thanks, Tiff. This is Wayne Eskridge. Many of you know me. I'm the CEO of the Fatty Liver Foundation and a cirrhosis patient. And I'm really pleased to be here today. And I'll be joined by Dr. Neeraj Mistry, who's our CMO. And this is a short period. So with that, we'll go on and step to the next slide. So the mission of the Fatty Liver Foundation is generally to improve the diagnosis, treatment, and support of people with NAFLD NASH, and we do that through various channels of education, screening, and patient advocacy. Next slide. We're the only national patient voice dealing exclusively with NAFLD NASH on the ground. Lots of interest in liver these days, but we're a rifle shot for the NASH NAFLD community. Next slide. We approach the challenges of dealing with the patient community and the industry and regulatory through multiple channels of education, advocacy. We support non-invasive screening. We have an active public communications effort, and we're great advocates for lifestyle change and wellness promotion. So next slide. This is me. You know, it's hard for me to believe that back in my salad days, that I had to actually lift up my belly to tighten my belt. But just as an example of what can happen with good patient management and exercise and diet and paying attention to better lifestyle, I have recovered from that really ugly liver that you can see the picture of there, and I lost a third of my weight, and I'm now, as a result of those experiences, I'm doing well, and that's what led me to start the Fatty Liver Foundation. Next slide. So I am really pleased with the progress I've made, and I'm kind of the poster boy for the fact that people who follow good practices have an excellent chance to improve their life, save their life, really. You know, I remember when I was diagnosed as a stage 4 cirrhosis patient that I wasn't in liver hell, but I could see it from where I was. And that wasn't an acceptable place for me. And so I'm an example of the fact that you really can succeed against this disease for many people. Now we're lacking drugs and we're lacking therapies, and there's a lot of things yet to come in this field, but we really want people to become a part of our mission. And we did a recent survey, and one of the things that was most striking to us was that we found that 1 in 3 people have no one available when they need any help. And this is a really important message for us, is that you don't really do this alone very well. So getting to a better delivery system for care and support are things that we really care about. Next slide. So I'm going to pass this to Dr. Mistry. He really favors this slide. It's a personal has a personal effect for him, and he's been a real advocate for patient health and liver disease, and it's been a great asset to our company with the as CMO. And this is Dr. Mistry.
Wayne, thank you so much. I got to say, I'm inspired every time I hear your story. And from a medical point of view, it's also very humbling to hear your story, because we often think that medicine is going to save us from all these health issues, but it's a combination of medicine together with lifestyle modification, diet, the social care and support that people need. So why I think this slide is really important, because it really represents the fact that we have all these diseases in the world, and they now seem to be converging on the liver in the form of fatty liver disease. And the frightening thing is that with all these other diseases, there's almost been a normalization of it. We've met many people who in communities who've said, I don't have diabetes yet. And so there's almost an expectation that diabetes, hypertension, being overweight or obese, having metabolic syndrome are part of normal life because of those environmental risk factors that everyone has. But what we're seeing now is that all these diseases literally converge on the liver. And this is our next big public health crisis. And the reason why it's a public health crisis is because from the patient side, as well as the provider side, there's not enough information about this. Now, it was argued from the provider side for a while, well, if we don't have an intervention, we don't need to talk about it, or we don't need to do anything about it. But while we don't have a drug intervention or a therapeutic intervention in that way, there are many, many other factors that we can intervene with. And Wayne is the example of, without medical intervention, was able to actually reverse his fibrosis and change the trajectory of his disease pathology. So when we look at these issues, we can see that the gathering storm is because of the lack of education. Our public health system is not prepared to actually deal with the increasing burden of advanced pathology in the liver. So things like fibrosis, cirrhosis, liver failure, liver cancer, and ultimately liver transplantation. And the costs as we go more advanced in these pathologies is going to be even higher and higher. When you think about a daily cost of an ICU or high care admission or even hospital admission versus intervening early in the workplace, in the home environment, in the community, we have an opportunity to prevent all of this. So we're on a campaign to raise awareness and get people screened for liver disease to take this up. But let me go to the next slide and we can talk about the Wellness League for a bit. Okay. So we conducted a survey on these issues related to education. And what we found is that 94% of all physicians indicated their patient health outcomes are affected by at least one social determinant of health. And this is where we talk about not just the health service, but those lifestyle factors. Very often in disease management, we talk about care, support, and treatment. And care and support are those two elements that are not about the medical intervention. Treatment is about the medical intervention. And so how do we create a package of care for patients and communities that involve medical as well as social determinants of health? So that's one. The second thing is it's a longer conversation to have with patients when it comes to social determinants of health. It means understanding their lifestyle, their risk factors, how they eat, what they eat, where they eat, the type of stress they have in their work environment, the type of social support they have. And physicians, when you look at the United States, the average time that a physician spends with their patient is between 6 to 7 minutes. And in that consultation, how can one actually go into all of this? So in counseling on social determinants of health or those lifestyle issues, we don't have the time or human resource to actually convey that information, okay? The next thing is, even when physicians are aware that they need additional support in the form of community resources, counselors, social workers, dietitians, nutritionists, etc., they don't have access to an immediate network to refer their patients to. And when you think about a comprehensive package of care, it's not just one referral. You need all those sorts of services to create that package of care. Wayne's success story was the fact that he and Rosemary put that package of care together for themselves. And it took a lot of work and research to do that. And so we need to sort of accelerate that process. And that's what the impetus for the Wellness League was. So with the Wellness League, what we've done is we've created this platform where we can provide all these services. Now, it's not creating new services, but it's creating a dashboard for all these services that patients can access. And with that, I'm going to hand it over to Tiffany, who will walk you through the Wellness League. Tiffany, over to you.
Thank you, Neeraj, and thank you, Wayne, as well. So now I am going to take you through the Wellness League. So let's pop on over. So the Wellness League can be accessed by going to www.thewellnessleague.org. And just to give you guys an overview of the project, so we still are in a soft launch phase. So we're still actively building out the various resources and content, but the site is functioning and it's very useful, as you'll see. So when you first get to the site, you're first welcome to join the movement, which of course we welcome you to do so. It's very easy to sign up, membership is free, and all you need is an email. When you enter your email, you'll be prompted to fill out a brief survey that just shares a little bit of information with us about your background, where you are in your disease, and that helps us to tailor the site to you. So let's scroll down a little bit. So here we're getting into the meat of the site. So on this first tab, you can see that there's a space to learn about NAFLD and NASH. And this is one of the main areas of the site. So our intent is to provide information that is, information that's accessible, yet still scientifically sound. So we provide information on a variety of different topics. You can see science, medicine, health, lifestyle, diet, and more to come. So let's say you're interested in learning about something new today. So let's pop into this article on coffee, which is protective of the liver. So I'm not going to read you the content, but we really want you to see just how short and sweet the content is. It's meant to be easily digestible, but yet you can see these hyperlinks linked to studies that back up the information that we want to provide. So let's take a step back and pop into the second tab, participate in important research. So through the Wellness League, you'll be able to be connected to clinical trials. So now I've given you an overview of the Wellness League site when you're not logged in. So I'm going to take you over to what the site would look like once you create the account, because it changes a little bit, but you'll see it's a change that's in a good way. So I've already logged into my account. Oops. And as you can see, you're first welcomed with a nice warm greeting by name. I'm Tiffany. And if we scroll down, you're first shown information that's new. It's shown in reverse chronicle order, so you can always stay up to date with information that's provided. And let's continue to scroll down. Here, there's an area for surveys. So similar to the survey that you'll take when you first create your account, these surveys are meant to, continue to tailor the site to you and your needs, your interests and wants, and we'll also use it to better the platform as a whole when we find out what the community as a whole is interested in. Scrolling down, you'll see we're bringing back the research opportunities. So here, once you're in your site, we'll be able to show you research opportunities that, again, are tailored to you, to where you are in your disease state. All right, and let's scroll back up. So now these resources that we provided are great, right? You have information, you have access to clinical trials, but the reality is living with this disease is hard. And sometimes education alone may not be enough to enact on those behavior changes. If you're struggling with food insecurity, struggling to keep food on the table, knowing about a good diet may not be enough, along the lines, joining a clinical trial, it might not be at the top of your priority list if you don't have a car, if you have transportation issues. So we fully and wholly acknowledge those issues. And out of that, we've added into the Wellness League a database that provides connections to local resources in one simple place. And all you need is a zip code. So let's pop on over to that, and you can access that very easily by clicking the Find Help button located at the top of your screen. So you'll be taken to this research database. And like I said, all you need is a zip code. If you know exactly what you're looking for, there is a field to enter that information, but it's optional. So for today, I'm just going to start with the zip code. Let's check out this Washington, D.C. neighborhood. Alrighty, and now you can see that we have over 3,000 free and low cost resources available to us in this Washington, D.C. area. So scrolling at the top, you can see the resources to make things manageable have been categorized into various areas. So we have food, housing, transit, money, even legal issues. So for this example, let's say I'm struggling with food insecurity, and maybe I'm interested in finding a food pantry. So let's pop on into the food category. We'll see the resources are subsorted even more into these different categories, and we can pop on into food pantry. And we'll see now that we've narrowed our resources all the way down from 3,000 to 104, which is still quite a large number, but it's definitely much more manageable. So here on the left side, we have a nice map that visually lets you know where the various resources are located. So if you're a map person, this might be great for you. And then on the right side, we have program cards that display information about the different resources. So I'll just show you quickly what those might look like. So now let's take a look deeper into one. Now, I really like these program cards because they provide, in my opinion, the perfect amount of information to make a decision on whether a program might be right for you. You can see very high level where the resource might be located. You can see their operating hours. And then if you pop into more info, very high level, you're able to see, what information is most important. You can see if you're eligible, what languages are offered, if there are any costs associated. And all of this is presented to you on this one site. You don't have to search through Google, you don't have to filter through ads, and you don't have to go through the program website itself to find the information. Everything is sort of presented to you in this one space. Though, of course, you can visit the program website if you want to. The links are provided through the league. So let's say we've decided that SUM's food pantry is right for us. So we're ready to contact us or contact them. What do we do? So simply click this next steps button. And we see we're able to get in contact with them by just calling this number. So once again, it's very simple to get in contact with those resources that you need. Another really nice feature is the ability to share information about programs. So if you know someone who might be in need or maybe want to send it to a friend, you can send their information through email or even text or even Facebook, really. All right. So now let's pop back into the search function. There is one more really critical search that I'd really like to share with y'all, and that's access to non-invasive tests. So we know that getting access to liver screening can be very difficult. So we've taken that extra step to compile a database of where those non-invasive tests are located. So it's very simple to access that database. Just go to the home page and click on this quick resource link. And once again, it's a similar structure. You have the program cards with the research information, next steps. And we can filter by zip as well. So let's take the same zip code. And now we know that there's a FibroScan located at Georgetown. And we can take the next steps to schedule an appointment. Now, there is one thing I do want to point about these non-invasive test resources. So the resources that I've stated before are free and low cost. However, these databases are ones that we've curated ourselves. And so the costs may not be free or low cost. So you'll definitely want to verify that while you make your appointment. So as I mentioned in the beginning, this is a work in progress. Every day we're adding new resources to the database. Something that we're working on is access to liver disease care centers. And through that, we really want to connect people to hepatologists because we've heard from the community that it's really hard to get in contact with hepatologists, and we want to make that easy. All righty, so that concludes the Wellness League in its current state. We're really happy with the way it looks, but we're excited to keep moving forward. So I'm actually going to share with you all a preview of what this profile site will look like in the future. So let me hide this.
Tiffany, that was excellent. Thank you for walking through that with us. And we do have one or two questions that have come in on the chat while you're pulling that up. But Wayne, I want to ask you a question. You had to do all of this on your own, find the resources. And I remember you telling us the story that the closest hepatologist was like 300 miles away from you. And now at our fingertips, we have access to all these resources. What's surprising to me is that Washington, D.C. has one FibroScan center that we know of. So hopefully we can populate that with more, or that sort of gives us a critical need that we have to advocate for. So how do you feel about having this community now and not having to sort of go on this solitary journey?
Well, I think this is it's our goal to solve the kind of problems that we dealt with. And, your example, of the Georgetown, there are other FibroScans around. We're just getting started on building all this material. I don't want anybody to think that this is a finished project. It is very much a work in progress, and the people joining us today are seeing one of the first demos of this site. The national database for local zip codes of free and cheap services is functional. Doesn't have everything, but it will be helpful to anybody anywhere in this country, I believe. And so we're bringing it out, even though we have a huge amount of work yet to do. And I think that this is a tremendous contribution to the community, and we're really proud to be offering it to people here today. One of the things that I think is important about the Wellness League that that I really am pleased about is that we've designed it as an ecosystem for other nonprofits, because we will be offering this tool to the local nonprofits that don't have the ability to build this kind of resource, and they'll be able to incorporate it into their local websites or into their local service offerings, and that will allow them to personalize this really and make it become part of the Wellness League in a real way, and it's not just a name that we run from our offices. It'll be something that the community can share across the country and join together as in a common effort to work on this disease and to get people to be healthier. And that's really the ultimate goal of the Wellness League.
Excellent. Tiffany, do you want to walk us through this page?
Yes, just very quickly, let's take a look at what your profile will look like in the future. All right. So once again, we're greeted and just giving you a very high level view of the overall page. We can see that we've modernized the look. We have more of a minimalist view. But more importantly, we really want to give you an experience that's even more connected and more curated. So let's take a look at some of these cards. So first of all, you'll see that this Find Help feature has been pulled out and placed front and center. So instead of being, not hidden, but placed in a corner at the top of your screen, it's front and center. And in the future, you'll be able to make a search right from your profile page, so there are fewer clicks. We'll also have surveys to help you to continue to build your community by contributing to the development of the league. We also make it possible to invite friends or family members to join the league. We're continuing to build out content, which will be easily accessed from your profile. And of course, you can learn more about privacy and manage your profile right from this homepage. So we're almost at time. So we're going to wrap up this view. And let's close it out. Oops. Are there any more questions in the chat, Neeraj?
Yeah, we have a few questions. And we'll just walk through them together. In terms of promotion, this is where we have a convergence of doctors and patients, or providers and patients. And so as a provider, it's wonderful to have this resource where I can refer patients. And within the network of providers, we need to start spreading the word on how we can refer patients, as well as the patient community, not just for liver disease, but the comorbidities, diabetes, hypertension, epilepsy, high cholesterol, metabolic syndrome, etc. They can all join the league, and in that way we'll build a stronger community.
One of the questions is, are we specifically looking at FibroScan? No, and our goal is to have all of the modalities show up. We just happen to, we're in the construction phase, so we don't have everybody and everything, but our goal is over time to be the most complete source of information about the tools and the processes available. So, and it's one way that one thing you might do is join the league and help us promote it. There's one of the biggest issues with education is how do you reach people, and the processes and peer-to-peer functions and the connections between people are the most important ways that we can do that. And any of you that have an interest in that ought to become members and help us build this process.
And Tiffany, I understand we'll have QR codes, we'll have the links itself that we'll be able to forward around using social media platforms like Twitter as well.
Yes, absolutely.
So we'll get available and people can spread it through their networks, and possibly after this conference, we can send it to the conference attendee list as well.
Absolutely. All righty. Well, we are right at time, and I'm so sad we're not able to get to the rest of these amazing questions, but we do have them documented. So we will answer them, and perhaps we can include the answers with the recording of the presentation. So with that, I'm going to conclude this webinar. Thank you everyone for joining. Again, my name is Tiffany Mensa. Do you guys want to close out?
Well, thank you very much, everybody. Really appreciate your time and look forward to working with you.
Wonderful spending time with all of you. And we will also make sure that we have this resource in different languages. We're working toward that as well. So take good care. Sign up.
Thank you.